Good morning, everyone. Thank you so much for joining us today as we commemorate the 2025 International Women's Day. My name is Fatima Al-Ghali, and I will be your compare for the afternoon, or at least half of the day. We have an exciting program lined up for you. We began celebrating this year's IWD on the 8th with social media activations, and today we have an in-person interactive event. We are not able to project the agenda, so I'll very quickly run through it in the interest of time. So we're starting with welcome remarks from our country director, Uche Amau, and then we move on to the first session, which will be focused on health, accelerating health for women, followed by a Q&A session, and then another session, Fireside Chat with Her Excellency, Mrs. Dolapo Osinbajo, and then another Q&A. Then we have an icebreaker, closing remarks from Ekenem, our Deputy Director for Policy Advocacy and Communications. And then I've been asked to let everyone know that we have a photo booth outside for photos, and we will have interviews immediately after the sessions. So maybe I'll just quickly mention that we're going to interview all of our speakers, all of our guest speakers, and then a selection of some of our staff. So watch that space. We will start with, thank you. We'll start with our guests so that we can free them to interact, and then we'll end it by interviewing some of our staff. And the content will be shared with everyone. Feel free to use it on your socials or as you wish. So to start us off, I'd like to invite our country director, Uche Amau, to welcome us. I'd like you to guess which of the doors Uche will be surprising us through. He decided to make an appearance, a cameo appearance. Which door do you think he'll be coming through, the front or the back? Front? Okay, so from the roof. I think the closest answer is from the roof. Let's welcome Uche.
Hi, everyone. Sorry I'm not there with you in person, but I did want to send a few words to appreciate all the women on International Women's Day, which is today. We joined the global community in celebrating the resilience, achievements, and boundless potential of women and girls in Nigeria and across the world. This year's theme for IWD is Accelerate Action, right? It reminds us that while we have made strides in advancing gender equality, there is much more that needs to be done to ensure that every woman and girl has the opportunity to live a healthy, empowered, and fulfilled life. At the Gates Foundation, we are committed to accelerating progress by investing in initiatives that improve the health of women and their children, expand access that they get to economic opportunity, and empower them to make decisions that ultimately shape their futures. There's 3 areas of work where we primarily do the bulk of our work in this area in. One is in the area of maternal, newborn, and child health. Over the past few years, the Gates Foundation has invested in developing low-cost innovations that have the potential to accelerate reductions in maternal and newborn child mortality rates in Nigeria and in other countries. This includes everything from daily pregnancy supplements to a single-dose infusion of iron that both address anemia in pregnancy, which is one of the causes of maternal complications, all the way to the use of a calibrated drip to improve the detection and bundle treatment of postpartum hemorrhage, and again, one of the biggest killers in maternal deaths. Then we didn't stop at the development of those innovations, but through programs like the MAMI program, which we are working in collaboration with the Federal Ministry of Health and the National Primary Healthcare Development Agency and other partners, right? We are now making sure that these life-saving interventions is available in facilities, and we're doing it by expanding access to the midwives and the skilled birth attendants that will be able to deploy these innovations, as well as making sure that there's a quality primary healthcare facility where women go to receive these innovations, right? Our hope is that through these efforts, we can make sure that women's health and well-being continues to remain a top priority for us and everyone we work with in Nigeria. The second area is family planning. And for this area, we know that empowering women with access to modern contraceptives and reproductive health education is pivotal in making sure they have the autonomy to make informed decisions about their bodies and their futures. So we've committed to making sure that there is enough stock of family planning commodities in the facilities, because there's nothing worse than a woman who has the intent to receive contraceptive but turns up in a facility and there's no stock available. So this is one thing that we want to make sure that is addressed. The third piece is around having women thrive. So we have an area of work where we call women's economic empowerment. And what we do in this area is to identify women who have interest in starting businesses or creating industries. And then we meet those women where they are by equipping them with the skills, right, with the technology they need and access to finances to be able to take these ideas and make them come to fruition. And by doing this, our hope is that we'll be able to break intergenerational cycles of poverty and drive economic growth, because we do know that when women have access to information and economic tools, their entire families and their communities always benefit. So these are the three areas that encompass the work that we do in this space. And while we celebrate these programs and these achievements, we recognize that true progress requires sustained commitment, collaboration, and bold action. So that is why on this International Women's Month, we reaffirm our pledge as the Gates Foundation to continue working alongside government, our partners, and communities to accelerate the change that is needed, and ultimately to create a world where every woman and girl can reach their full potential. When we invest in women, we invest in a stronger, healthy, and prosperous future for all. Thank you, and happy International Women's Day.
So thank you, Ekenem, for guessing that Uche was coming through the roof. I'd like to very quickly introduce the next panel. Like I mentioned earlier, this panel is going to be focused on accelerating action for women in health. I'm going to shake up the norms a little. Normally would introduce our female speakers before the male, but because we have a he for she in our midst, I'm going to invite him first to join us. So Dr. Kabiru Atta from Engender Health. Dr. Kabiru Atta is the country director for Engender Health. Our second guest speaker is Ifeoluwa Dari Johnson, Executive Director for Health Tracker. So this session will be moderated by no other than our very own Dr. Mojisola Odeku. Dr. Moji's title is very long. I hope I'm able to. So, Dr. Moji is Senior Officer Advocacy, Government, Multilateral and Strategic Partnerships.
So thanks everyone for showing up for women today. We know it's a long journey. And in this session, we're going to look at how to accelerate action for women's health. It is a topic that is important to all of us, whether in homes, communities, private sector, or in government. Today, we've actually intentionally brought two people who are working on the field, who know where the rubber hits the road. Dr. Atta, through the work in communities, working with governments and the state subnational level, and Ifeoluwa from the private sector, innovating digital platforms to amplify women's health. And so I'm going to ask the two of you, right, broadly, what exactly, based on your experience and your reflections, where should we be accelerating action for women's health? Who wants to go first? Dr. Atta?
Yeah, I could go first.
Okay.
Yes. Thank you very much, Dr. Moji. Good morning, everyone. Yeah, so I think in terms of, if you look at the what has happened in the last couple of months, you will notice that there have been several global and national shifts in the landscape, especially towards women's health. First of all, it's been a pullback of funding from the US government. And second, you've seen several European Union countries also begin to say they are pulling back on funding, even though in a more gradual phase as well. And most of those fundings are beginning to affect women's health as well. Mm-hmm. So we need to, so for me, that means that for this 2025, we need to collectively begin to see how we are accelerating actions towards addressing women's health. We need to bring it back to the front burner. If you also look at what happened in 2020 with COVID, where with the advent of COVID, there was a shift in priority from women's health towards emergency preparedness in the country as well. We are seeing climate change begin to ravage most communities, and we're also beginning to see shift in funding go towards those in those cases of diarrhea to manage those issues as well. I think for me is how do we begin to reprioritize and make sure that the governments are being accountable for the work that they're supposed to do. If you increasingly you'll notice that the government is budgeting for activities that's targeted towards women's health, but in terms of prioritizing the release of those fundings, that's where the biggest issue is that we see. And so for me, unless we begin to address these issues to accelerate action towards women's health, bringing together the private sector, bringing together the government, we will not be able to really close the parity gap. What we've seen on the field is when you invest in women's health, it tends to also have economic benefits. One area that I see we have not taken so much action is strengthening universal health coverage. Usually I try to link health insurance as an economic tool for women. You find out that in terms of women making decisions around their health access, finances is a major barrier. Okay. One of the reasons why most of us in this room, when we get phone calls that our children are sick, our spouses are sick, we're able to say, go to the hospital. It's because we are insured. We don't get hit by that immediate bill that comes that hits us as well. But that's not the case for millions and millions of Nigerians. Okay. At the last count, less than 10% of Nigerians are insured, including women. So I think that's an area where we need to accelerate.
Okay, so I'm picking from you, Dr. Kabiru, that ensuring access to quality health for women, the North Star is expanding access to health insurance. Yes. In all the modalities, whether it's community health insurance or state health insurance, or even private sector, because we do know women through cooperatives that they do for entrepreneurship. That means also encouraging them to put insurance into those women's groups into entrepreneurship. Thank you very much. Ifeoluwa, I know you are in the private sector. Digital innovative platform is your passion. How might we use digital innovation to expand access to women? And what exactly do we need to accelerate action on the digital platform from your experience in the private sector?
Thank you so much, Dr. Moji, and thanks for having me here. What we've realized is that women's health is so central and is such the bedrock of a thriving society. And in the private sector, when we think about it, especially when you're creating solutions and innovations that you can scale and drive impact, we realize that women are spending 25% more time in poor health than men, despite the fact that women are living longer. So the first thing we did then was to begin to look at where are the innovations that actually help women live healthier lives. How do we create solutions that are targeted, that are thoughtful, that are designed to improve the lives of women, right? So, and sometimes it requires us actually sitting with women and sitting down and understanding. And we did a lot of social listening, right, to say, okay, what are people complaining about? What are the challenges? I remember that one of the things that we realized is we said women need to screen for cervical cancer, for example. How do we do that? How do we increase the adoption? But it seems like because of how busy, everybody needs to be now, even for people in rural areas, you have to go to the market, you have to take care of your children. So when you say come in and do your screening, women are like, you know what, I'll do that later, right? But how do we ensure that it becomes easier for women? Because again, we're designing for women. So we realized that what if we could bring it closer to them? How come telemedicine and financial services and all of those things have been so digitized that you don't need to go anywhere? Then when it comes to healthcare, we say you have to come to the hospital. And that's what we're beginning to look at when it comes to innovation designed for women. So one of the things we did, for example, we created a solution that allowed women to be able to use self-sampling kits to screen for cervical cancer. We have solutions around STIs as well. 65% of new HIV cases are found in young women in sub-Saharan Africa. And it's because it's the taboo. You don't want women are stigmatized if they confess that they're having sex, which, obviously is happening. But how do we ensure that they're screening unwanted pregnancy, contraceptions, family planning in a way that still protects women and they feel confident to go out and ask for the help that they need? So when we look at it in three-pronged approach, right? Advocacy, super important. Most of the time, people do not even realize that this is a problem. So women feel like pain is part of womanhood. So, menstrual pain, of course, is normal. So even when you go to your doctor, they tell you, come off it. You're not the first woman in the world to have menstrual pain. When you're pregnant, it's like, don't worry, just take paracetamol, it's not a problem. But women are designed to be unique because we have different issues. Hormonal health, I know a lot of people are struggling with PCOS, fibroid, endometriosis. A lot of these things are becoming more rampant. And it seems like our health systems is not designed to really focus and solve for these problems, right? So when you look at that as from an advocacy point of view, how do we ensure that we're creating platforms that allow everybody to sit at the table and then work together to design this? And then we then can move to innovation, right? Which is some of the ones I mentioned. Now we have an initiative where we're working with pharmacies to say self-sampling kits, discreet, we call it lemon. Just go to your pharmacy and ask for a lemon. Your pharmacy knows what you're asking for, and they just give you a pack. It looks like, it's put in a brown box. You can take it home, take your own samples, a little bit by yourself, and that's it. Logistics picks it back from you. How do we design solutions? And that's what we mean by accelerating action. How do we accelerate the ecosystem to design solutions that are tailored for women? And then before we now begin to move into research, so advocacy, innovation, and research, that's the way we think about it when we say, how do we use technology? How do we use innovation? Research is such an important bit that we need to accelerate for women. Again, all of these things, so many of the solutions that we're expecting, we're thinking will come from the West. Sometimes it needs to come from ourselves. I was speaking to Professor Afolabi just yesterday, and some of the work that she's done in researching for sickle cell anemic women, pregnant women, and with our HIVON trial. And there are so many locked great ideas in universities, academic institutions that we can quickly accelerate to bedside, to clinicals. And that's how we think about accelerating action. How do we ensure that the entire ecosystem have the tools that they need to actually improve health outcomes for women?
So thanks, Ifeoluwa. I would like to zero in on underserved communities.
Yes.
Bearing in mind that digital solutions may not be accessible to those women.
Yeah.
So what are the innovations that we can amplify, to ensure that they also benefit from what you're talking about more for urban people? Are there offline kind of innovations that you think can help? Because this is where the rubber hits the road.
Absolutely.
The poor statistics are actually coming, from underserved communities. I know underserved even within the urban areas, slums, and then within the rural area. So how might we accelerate action to ensure that they are fully covered so that we can up our positive outcomes?
Absolutely. I always say that innovations have to be scalable. It has to be impactful, and it must not discriminate against a group of people just because of where they live, right? So, and a good example, last year we launched a product called Lola. So Lola is an AI tool. We are a technology company, so we could easily have built it on mobile apps, download an iOS, and all of those. But we built it on WhatsApp. And we said WhatsApp already have 95% coverage, which means even with feature phones, people use WhatsApp nowadays, right? So if we can ensure that on WhatsApp, you have access to menstrual health education, reproductive health education, you can get resources. you can go to the nearest primary healthcare centers to you. So imagine if you're pregnant, month 1, this is what is expected, and it can be in your language. So innovation can be impactful and be used for communities that are not urban. In fact, that's the idea of technology and innovation, because if it's only directed to a group of people, then it's not effective. So the onus lies on us, on everybody who is innovating, to say, how do we ensure that innovation that we're creating, it's something that can actually go around. Another example is USSD. People actually are using USSD now to reach, and you will be amazed how great these opportunities are. Mapping primary healthcare centers across communities, mapping medical professionals across communities, and ensuring that low data type of applications are being used to ensure that you steal everything that someone in Lagos can do, someone in Kafancha or wherever I can do that. Another example was, I mentioned the HPV self-test kit that allows women to screen for cervical cancer. One of the things we tested from day one, we went to a village in Kaduna, and we said, we don't want only women in Lagos or in Abuja or, people who are educated to have access to this. Can we even pilot and test that someone who does not speak English, someone who is a rural...
That was going to be my next question.
Who does not even understand this entire thing, would they be able to use it? Yeah. And we recruited about 100 female farmers, women in... Their Hausa is not even like our regular, it's like the dialect Hausa. And, we recruited their community, the community health workers, and we worked with them. We translated everything in their local dialect. And at the end of the day, 98% of them used the kit. 5 minutes, they went into the mobile toilet, and they were out. And that's it. Right, so we realized, when we're creating, we have to be intentional. The onus lies on us as innovators, as policymakers, as governments, to ensure that we're not segregating technologies for everyone, not for a particular set of people.
Okay, you've actually answered my next question, which was, how do we make sure that this AI tool, Lola, or which other brand you have, is in indigenous languages, at least the major ones, Hausa, Igbo, Yoruba. We know we have a lot of dialects, but the common one that people use and can relate with,
Absolutely.
I love the USSD. I didn't know that's available, but that's good, because the financial inclusion team have been using that. So why can't we pivot women's health, self-care, into that? Thanks. So rounding up, Dr. Atta, what action would you want us to take away as a collective here?
I think for
one
me,
takeaway that we can.
I think for me, I still come back to my last
progress.
comment around universal health coverage as a key.
Yeah.
I recall we did some work on women's health, fistula in particular, where we did an actuarial study for the country, working with the National Health Insurance Agency to say what will be the additional cost of adding fistula as a key benefit for fistula clients in the country. Because historically, to treat fistula in Nigeria is free. But when you go to the hospital, they don't have access to materials because the government is supposed to release monthly subventions to those facilities, which is inefficient. They get released at the end, either end of the year, or when they get released, by the time it flows down, it's not the actual amount gets there. So what we did was to do an actuarial study. And then we presented to the Federal Ministry of Health and to the NHI to say, you can actually cover the cost of this woman because the additional cost was 18 naira to the premium when we did the study. And that's what helped to propel the government to actually launch the National NHI Fistula Steering Committee. And currently now, they tested it in 4 federal government fistula centers last year. And now over 18 fistula centers have now been accredited where any woman with fistula can walk in across the country. You just walk in, you get treated, and a fee, the claim is sent to the NHIA, who pays the bill. So it means that women with fistula in this country, as long as you can access this, and that's the approach that we took also for cesarean section. The minister just announced 184 facilities now. Women, if you have emergency cesarean section needs, go to those facilities.
Yeah.
And that's what we want to do for postpartum hemorrhage. Postpartum hemorrhage is the #1 killer of women in this country. Imagine if every woman that has postpartum hemorrhage in an underserved communities can walk into any facility and get access. And that's why, through the advocacy project we're working on, that is what we want to see and push forward.
So thank you, Dr. Atta.
Thank you.
Key message, expand universal access to health for women through health insurance and ensure that the benefit package of the health insurance covers the needs of women, which means we must be flexible to update the benefit package. All right, thank you. Ifeoluwa, one key action that we should take.
One key action would have to be that we accelerate the ecosystem.
Okay.
So
digital platforms.
Exactly. And what that means is the entire ecosystem needs to act, right? So it is, so again, I think about it from medical professionals, Association of Gynecologists, mental health specialists. How are we ensuring, are we training, are we supporting these people or these medical professionals to be able to better design solutions and healthcare for women? And then we think about academia as well. That ecosystem, how do we support academia who are doing good research to actually help them accelerate whatever the ideas that they have to get to bedside, ASAP, to commercial, to government, and maybe even subsidize so that everybody can have access to it. So, for example, fibroid apparently has, there are different methods now to ensure that fibroid surgery can be done without even the surgical bits, right? All of this becomes very useful for women. So I would say when we're saying accelerate action, it would be how we need to look at the ecosystem and accelerate the system with support, with training, with encouragement to just ensure that everybody is on the right path.
Thank you so much, Ifeoluwa. We open it to the floor for questions and answers. Questions, comments, reflections. I'm looking at some people. I don't want to call out. This is women for women. Grace.
Thank you so much.
Pleasure.
I was trying to take notes and then I just realized it was better to. It was much more interesting.
Thank
you
you
for all that you do. My question is, what has been the result so far? Can you just pinpoint one particular innovation that you tried out, and how do you follow up? So you went to this village, you met these women, and they did the tests. Is there a way to use technology to, collate the results and then to follow through?
Yes, absolutely.
Sorry, Ifeoluwa, maybe before you answer, Grace, if you could please introduce yourself so she knows who she's speaking with. And I think maybe when you're asking questions, please just introduce yourself, tell us what you do, and then ask your question.
All right. My name is Grace Alubari. I'm a program assistant here in the Nigerian country office.
Thank you.
Okay, so one example, as I mentioned, is self-sampling kit for cervical cancer in Kaduna. One of the great outcomes, we began to see patterns. Out of 100 women that get screened for cervical cancer, for example, and that's what data, you begin to see the data, we were seeing minimum of 4 people were positive, right? So it helps us so anytime we go to a community, we already know that we must find, the treatment and care for those people, even before we screen, right? So we partner with their communities. We ensure that there's referrals to tertiary or secondary hospitals around them, and we follow up, right? And then, even from like a technology point of view, what we do on the back end is we ensure that there's a health dashboard, and we're able to track over time. It's almost sort of like disease surveillance, right? To see how many people are positive and all of, because it then informs how we think about scale and the continuum of care as we think about it. So same even with Lola AI as well. That's a great thing about digital technology, it gives you access to data because on the back end you can see. We see what the women are talking about. Again, of course, completely anonymized, right? But you begin to see patterns and see what the recurring issues that women are going through, and that becomes a tool for you to design more targeted solutions for women.
Yes. Can I ask a question? Okay.
Nice one, Grace. Okay, so because Grace has asked, I'm Fatima Al-Ghali, and I'm a senior communications officer at the Gates Foundation. So just thinking about digitizing health solutions, when you talked about telemedicine and why we can't use digitals to solve some of the health issues, I was wondering around how are you able to build trust, especially at community levels, for women to actually open up, one, to believe and trust that I can trust a robot, I can trust Lola, I can trust a WhatsApp message with my health. How do you work around that?
Yes. Okay, please.
Can I also add?
We don't know who you are.
Mike.
My name is Yusuf Yusufari. I'm a deputy director leading the immunization work. So, I like the question Fatima raised around how do we or women actually trust their health with some of these apps. I think beyond that and bringing my immunization hat and some of the work we did around HPV, how are we also addressing those deliberate fake news, misrepresentations, that are also churned out and using the same platforms, and they have faster reach than the conventional work that we do. And in Hausa, they said the ears that listen to the wrong news, you will work hard for it to hear the right one. So how are we really rethinking that? First. Second is, how are we simplifying these tools to be fit for purpose for those at the real ones at the grassroots? You understand? If you just imagine the kind of phones that people use out there.
Yeah.
Is the 3310 of those days. Those who understand this. People old or like me, very old people like me. If you say 3310, you know what they mean. So as we develop tools and technology to address today's women's health, I think we also need to also bear in mind those tools those kind of phones they use. And finally, also around voice messaging. I think because of literacy rate, the kind of phones they use, I think we have to also rethink how we do voice messaging. Voice messaging would be very critical. We learned a lot of lessons in the immunization space in using voice messages, prompts. How do we prompt women to really reach out for health ASAP? Because sometimes the difference between life and death is that few minutes.
I agree.
Thank you.
Okay, so yeah. So definitely I'll start with the trust bit. And so when we started, again, from our experience, when we started with innovation because, again, private sector will create solutions, we go out and just want to put the solution out there. But we quickly came back to advocacy, right? Because of trust, right? People needed to know that we want to listen to them. We want to hear them. And that's something that now we're spending a lot more time doing, right? Because you cannot solve problems for people that don't think that you care about them, right? So, and that's also something, again, collaboration, working with people already on the ground, people who already are solving the problem today. It may not be as effective, but they are the ones available right now. So we realize that a lot of advocacy and actually collaborating with the community and coming down to everybody's level and letting them know, because I come from, I grew up in the village too. I look like I came from Lagos now, but I grew up seeing all of these things. So I understand, right? And I think that level of vulnerability when you're creating solutions become very important. So we quickly realized that the way to develop trust is to work with the community, to work with all the key stakeholders that already exist in the different sector. So that became very key for us. And then number two, as you mentioned, right, I do agree, because of, lack of access to digital technology and, sometimes all these fancy things is also what has led us to just being very nimble and simplifying, as you said, right? So, for example, I mentioned Lola AI the other time. If you chat with Lola, Lola does not feel like a sophisticated bot. It's just like you're chatting with a regular person. Again, specifically designed that way. And which is why we also are looking into USSD and all of those things right now as well, because we realize that for the women who need the most, you may be using 3310. Thankfully, WhatsApp, I found a way to get into those feature phones for one reason or the other. So we're like, let's use the tools. And you mentioned something that's very critical, which is how do you combat fake news? So you know how in parenting they tell you that you ensure that your own voice is louder than the voice of outside people, when you're parenting. We realize that that's actually what needs to happen. Our voices needs to be louder, which is why, where are they distributing that fake news? Let's be there together. So we're combating fake news for good news, or for the truth. And also, one of the things we've realized is digital health cannot be isolated. Mm-hmm. It's not digital health or nothing. It has to be integrated when you think about it. Oh, okay. It has to be integrated if you think about it. So as we're doing digital health and they're seeing the message on WhatsApp, they need to be hearing it on the radio. They need to be seeing the flyer when they go to their community pharmacies. So, for example, we went to community pharmacies to distribute the self-testing kits because we know that's the primary healthcare center for most people. Right. So again, those are some of the ways that we're like, how do we drown and ensure that the voices of the truth is bigger, that is louder rather than the voice that of fake news. I hope that answers.
Yeah, I just want to highlight one of the questions from Yusuf, that how might we use this digital platform? As you are engaging them, there are some fake news that will be coming. Yeah. And those fake news will be projected with the fact, using the digital platform. Because many people, get their news. We are all digital enabled now. Even in rural areas, they can call their children and say, what is this one saying? So the highlight from Yusuf is adding combating those myths and misconceptions, maybe modified on your page, where key questions, this is a lie, this is the truth, integrating that, like you rightly said.
Absolutely.
My question was going to be, how do you link with the likes of Dr. Kabiru that's working with the public sector?
Absolutely.
To help pronounce these issues coming from women in rural communities or underserved communities as to what's needed to be expanded on the benefit package. We are saying universal health coverage.
Yeah, I think I always say that the biggest spender in any economy is the government.
Yeah.
If the government has not keyed into your program, it will not be sustained most of the time. If you check even historically, companies who have been successful, both in Nigeria and globally, they have historically benefited from government incentives, government subsidies, government grants, government loans. And so as you work to digitize, to develop digitization programs, you have to make sure you're integrating it into the existing healthcare system.
Absolutely.
So a good case in point is some health insurance companies have begun to offer telemedicine service as part of the service they offer. That way, there's a system for payment for this service, which makes it sustainable. If you look at the NHIA structure, 5% of the money is allocated to support health insurance ICT services. So how the government has a robust data digital policy. So how do we work to ensure that we're integrating all of this into the work as well?
So thank you so much. We'll be rounding up this segment, and I do hope we've taken some key highlights. I have, and I do hope some suggestions we've also offered through this discussion, will enable you further to amplify action through your platforms. Thank you, Dr. Kabiru and Ifeoluwa, for honoring us with this. Thank you. And thank you for everyone actively listening and digesting and learning.
Shall we please rise for our special guest of honor?
Oh, okay.
Thank you.
Good morning, ma'am. Thank you, everyone. Thank you, camera people. I'd like to formally introduce our special guest of honor for today. She actually requires no introduction. She's a household name, but we're duty-bound to do this. You're very welcome, ma'am. I think we should give a resounding applause just to show her how honored we are to have her in our midst. This is Her Excellency, Mrs. Dolapo Osinbajo, wife of the former Vice President, a mother to all of us. Thank you very much for making the time, ma'am. We'll jump right back into the agenda. Some of us have received pieces of paper. I'm going to call in no particular order 3 numbers, one after the other. These are fun facts around accelerating action for women. And they all come with hashtags because a wise man once told me, never underestimate the power of a hashtag. He's smiling at me right now. So yes, each of these fun facts come with related hashtags. And for the social media buffs within amongst us, please feel free to post them and tag the hashtags. I'm not sure I mentioned earlier, but we are live on YouTube. So smiles, everyone, even when it hurts. Okay, so let's call on number 3. Does anybody have number 3? Oh, Dolapo.
Thank you. My name is Dolapo Osinbajo. I'm a senior programs coordinator at the foundation. More women in politics, stronger nation. Countries with higher female political representation tend to have better policies on education, healthcare, and climate change.
Hashtags.
Oh, the hashtag. Hashtag women in politics. Hashtag lead the change. Hashtag equal representation.
Thank you, Dolapo. I think we all agree that we do need more women in politics. I'd like to call on number 7, please. A he for she.
So what I have here is women's economic power equals global growth. If women had equal access to economic opportunities, the world could add $28 trillion to global GDP by 2025. That's like adding another US economy to the world. Wouldn't that be wonderful? Hashtag women in business, gender equality, hashtag economic growth.
Thank you, Kalilu. One more fun fact. Number 9. Who's number 9?
It's looking like 6. Your Excellency, my name is Yusuf Yusufari. I'm a Deputy Director with the Gates Foundation. So mine is educate a girl, change the world. Oh, lucky me, I have 3. Each extra year of schooling for a girl boosts her future earnings by 10 to 20% and leads to healthier, more educated families. Oh, how blessed are we? Hashtag girls education, future leaders and empowerment.
Thank you, Yusuf. Do we take one more or we proceed with the agenda? One more. All right, then let's go to number 1. Who has number 1? Timmy Tokwe has number 1. Starboy.
Your Excellency, ladies and gentlemen, my name is Timmy Tokwe. I am the AV support technician at the Gates Foundation. So this says, your voice matters. Every time you support, advocate, or empower a woman, you're accelerating action for a better future. Hashtag IWD, hashtag accelerate action, hashtag empower her.
Thank you, Timmy Tokwe. And because I have the mic, I'm going to add my very personal one. It says, the rise of women is not about the fall of men. hashtag gender equality, hashtag gender parity. So no threats, don't feel threatened. We can all rise together. Exactly, Chiamaka, we rise by lifting others. So Your Excellency, permit me to continue with the agenda. I'd like to invite my colleague, Grace Alubari, to lead us in an icebreaker.
Thank you. Maybe I shouldn't have taken this role if I knew it was going to be this serious and gorgeous. Well done, ma'am. It's such an honor to be in your presence. Maybe some of you do not know, but one thing I think I cannot forget about Her Excellency is what she does outside. And I would love to let you know she is amazing at crocheting. True, madam? And that just tells you that at some point in time, you need to have, we need to have, I'm asked to join you here. But I'm supposed to be breaking the barriers we need to have life and skill outside our 9 to 5. And so it's quite interesting to see that she could take time, and I saw a video, it's a 10 minutes video, I don't think we might have the time, but you should look it up on YouTube, where she's crocheting, and she's telling us that you can enrich your life outside your regular job. I haven't learned that lesson because what I enrich is my couch from 6 p.m. and mindless scrolling, but I'm going to get there. This year, I promised new skills, new learnings. All right, so in this section, we are going to pass the mic. So you see why I have to leave here, people. We are going to pass the mic, and the rule is very simple. You talk about a female, because it's our day. Thank you to the gentlemen looking so wonderful in their face caps. A round of applause for them, please. Thank you all so much. All right, so we would pass the mic, but you will say something about the female you're about to give it to. And then, if you're good at expressing yourself well, we'll know exactly who you're speaking of. I had someone in mind that she has not refused to be here. Very typical of her. But I would say something about this person, and hopefully we get a good idea of who she is. And if she's listening, I will pass the mic when I see her upstairs. I'm passing the mic to a lady who carries the weight of portfolios. And she still finds time to pull up a chair, to listen, to guide, to shape. She brings structure. She's wrapped in wisdom, intelligence laced with warmth, never too busy to show the way. She curates the rhythm of the team, a keeper of norms, a voice that whispers, assume best intentions, and offer grace. Who could I be passing the mic to? Onyeka. She's never in the spotlight, but she does so much for the team. All right, so she's carrying. So indeed, we are grateful to have her with us. So I'm going to give the mic to, I'm giving the mic to Amy. But just to be sure, so that we're not just passing to women, I'll take the mic from you at a point, give to the men, so they too can say and show that they know something about us. So Amy, you say something very briefly about the woman you're about to pass the mic to.
Yes, it's our day. Okay, so today I'm going to pass the mic to someone who brings life to all our events, someone who is really, really happy to put all the moving pieces to make one beautiful whole picture. And then she is one of the people in this office that when we are expecting, when we're having a huge convening, right? She's on her toes 24/7, ensuring that everything goes as planned. So can you guess who I'm passing the mic to?
Please, that's our program as manager.
Up and grateful, we're up and grateful. Thank you. Where's that boy? All right, thank you. Thank you, everyone. I won't say pleasure to be here, but yeah, pleasure to be here. Chiamaka Chimendu is the name, Project Manager, Nigeria Country Office. Please, what am I supposed to do with this mic?
Tell us, pass the mic to another amazing woman, and I'll take it from you after that.
Okay, passing the mic. Hey, this one is hard. Okay, so I'll pass the mic to, so two of the people I want to pass the mic, how do you pass the mic to two people? I should pick one. Yes. Do a short list. Right, so, Passing the mic, I'll pass the mic to, today. It's so hard. So I'll pass the mic to a lady, another woman who is, I don't know how to create all this, so I'll just say it, who has been dubbed in different platforms as the joy of the NCO. We did a fun fact one time and realized that she's a trained nurse. I did not know this before. It was so fun to do that because nobody could guess it. But she is a pillar of support that we've had, for all of us, here, even looking across the room, holding us from behind the scenes and pulling the strings that, hold us up together to keep us smiling. And so passing that mic to someone that we're all guessing.
Oh, okay. Okay. I guess I need to move forward. Or should I stay where I am? Thank you very much. I don't know where we're staying here and our guest is here. Can I come forward? Aha, let her see us. Thank you for the mic, and thank you, everyone. My name is Joy Emelogu, and I'm a senior program assistant in the foundation. Done that for about 6 years plus. So who do I pass the mic to? We've done a lot of female. The male supporters, next year they won't come. So it's good to pass it to a guy, and I'm really scrambling. Anyway, there's somebody who is our mover and maker, in the sense that anything gets tough, you are sure. This guy will morph into security guard, into everything, just to make sure that it works. So anytime we're having a situation and the person is in town and around, we're so happy. He's a supporter of women too. And that's Oga Kalilu.
We didn't see that coming. Senior K.
Thank you, Joy. The thing with I'm not sure, but I think you can as well say that I'm part of this celebration because in my house, at peak period, it's a ratio of 1 to 3. Sorry, 1 to 5. Yeah, off peak is a ratio of 1 to 3. And one thing I have learned in life, and if you really want to be happy, have a lot of women around you. Not in the sense of polygamy per se, but that also could be part of it. Could. But the thing is, one thing and the other thing again, I've worked in several places, and I've had 80% women supervisors. And in those roles I've performed the best. To date, I still have, this is my second year in the foundation, I've had 2 supervisors, both of them women. And then people ask me, how do you get along with these people? I say, no, women are the easiest people to get along with. If you understand that they are the most empathetic people, right? Because it's not easy to carry a child for 9 months when you give birth. There is no other person that can compete with you in those positive human attributes: love, care, carrying the burden. And I wish I had the opportunity 3 years ago of saying this in your presence. One of the things I think we should be advocating for in Nigeria is, how do we compensate women for the work they do that is not paid for? What is known elsewhere is that no matter what a woman does, she still has a huge work at home, providing and caring for the family. And that's often not compensated. And it's not just about us. If you listen to the former, I think, CEO of Pepsi, there's this famous interview she has with her, and then how she's trying to manage. She said she rose to become the CEO of PepsiCo, but still at home, she's seen as such, that woman of the house. So, but I think if there's legislation to say that women should actually, wherever they work, they should get full pay, but work 25% of the time.
Yes. On that high note.
You see, it may sound sound economically impossible, but then that's if you are looking at it from a narrow perspective. If you look at the broader context and the society, I think we are all better off if we do that. There will be more productivity, there will be more happiness, and there will be more progress.
Please pass the mic.
International Women's
Pass
Day.
the mic. So pass the mic. Say
So
something
today,
about it.
I think finally I will pass the mic to somebody who in this office, somebody who has broken most of the barriers we know in this office. This office is a highly fluid place, right? Very high turnover rate. But then there's somebody in this room who seems to have survived it all. But that's because she comes with a very strong, character, positive character, integrity. But that focus, that high level of focus, but also a great deal of discipline. This is somebody that if you come to this office at 10 minutes past 8, you're sure that she's always in the office. If you didn't see her in the office, she's not in town. So I'm passing the mic.
Now you put me on the spot. So, okay, so I don't know if coming early at work is a blessing or a curse, but I kind of, I'm a morning person. So anyway, I'm very honored by getting the mic from such wonderful colleagues. And Your Excellency, welcome again. So who should I pass the mic? Okay, so the mic to someone who's not around, but one will receive it for her. I tend to come early, and when I come at 7-ish, the only people that really come to greet me and ask me if I want coffee and socialize with me, and sometimes they're like, can we take pictures because we like this outfit? So we play, I go like a catwalk, But none of you is there at that time anyway. So we do the catwalk thing and they take pictures. I guess they will put it on their Instagram, I don't know, but they take a lot of pictures and then I go back to my desk. And this is really, the mic is for all our early workers who maintain the place, make the place make the place what it looks like. You don't clean after us, really nurture us, make sure we eat on time, make sure there is water, make sure there is everything. And Dorcas leads, followed by everyone within the team. So I don't want to forget anyone, but it's for them. And maybe I will have Dolapo for them. You take the mic on their behalf.
Okay, I will pass the mic to a lady, the first face you walk into when you get into the office. She's always smiling, very receptive. She takes the best pictures. But then it's such, I remember my first time at the foundation. I had not resumed, I just came in. I knew I was joining. And then I came in, and then she mentioned my name and said, welcome. I was like, sorry? I've not even resumed. I still have like a month or they're about to resume. And it was such a welcoming place. I think that was my first feel of the foundation, and it was great. So I'll pass the mic to Victoria.
Good morning, Your Excellency. Good morning, everyone. I'm going to pass the mic to, this is long time coming from probably our old office. it was just like a small family. And when I started, I didn't really have any navigation, but then she guided me and then she put me through. So I'm just going to, I don't have much to say. I'm passing the mic to Ese.
Thank you so much for passing the mic. Yes, we will take a break here.
Thank you. This is now Take the Mic. But I think we didn't clap for Essie. We need to clap more for Essie. Thank you, Essie, for all you do. I'd like to introduce the next session, but before I do so, I just want to ask around for your thoughts around what is a household item or a household name to you. If there's something that is just part of your household, that is just, it's always been there, it'll always be there, what is that thing? Okay, Maggie, that's one. Sorry? Ijebu Gari. Oh, yes. Came very handy yesterday. Pepe. Okay, Pepe. So food. Food. Okay, so water, television, tea. Thank you very much for all of that. The reason why I asked is, I had said this earlier, but I think we cannot say it enough. I'd like to use this to introduce our next guest. She is a household name. She is as popular as your Gary and your Maggie and your tea and your TV sets. She's somebody that we all look up to. Personally, I have followed her on socials for such a long time. I get inspiration. I get fashion tips. I've learned to tie my head tie a little more. And I know that there's so much that we have learned from her personally, virtually, however it is we interact with her or her personality. So she's a leader. She's an exemplary icon, a mother to the nation. And as profoundly captured in her book, we call her Mama. So it is my great, great honor and privilege to welcome to the stage today our special guest of honor who will speak to us around accelerating opportunities and action for women on economic opportunities, Her Excellency Mrs. Dolapo Osinbajo. Thank you, ma'am. And she will be joined by no other than a fellow fashion icon and another leader, Dr. Rodio Diallo, our Deputy Director for Family Health.
So thank you very much, everyone, for being here today. And I would like to introduce our guest in addition to what Fatima has shared. Her Excellency Dolapo Osinbajo is a distinguished lawyer, author, and social advocate. She joined the Nigerian bar in 1990. Her legal background has significantly influenced her advocacy work, particularly in areas concerning women's rights and beyond her role as the Second Lady of Nigeria. She has been deeply involved in philanthropic endeavors. She co-founded the Orderly Society Trust in 2007, an organization dedicated to promoting Christian ethics and orderliness. Additionally, she serves as the executive director of the Women Helping Hand Initiative, a refuge facility established in 2014 in Epe, in Lagos, aimed at supporting vulnerable women and children. She's an accomplished author. She published They Call Me Mama from the Underbridge Diaries in 2014, a book that chronicles her decade-long interaction with street boys and men in Lagos State, providing them with human face and sharing their stories. Her unwavering commitment to social justice and community service continues to inspire many across Nigeria and beyond. Welcome again. Thank you for making the time. Please applaud. So we have a few questions. It's a conversation for you in this very special occasion. The first one, as said in your bio and all the testimonies we heard today, you've been a strong advocate for women empowerment. What inspired your passion for advancing women's rights and opportunity?
First, I'd like to say thank you very much to the Bill and Melinda Gates Foundation for your kind invitation, and good morning to everyone, and happy International Women's Day. Thank you also for all the kind words you've said this morning. I got into working with women through the men. As my book indicates, I worked with area boys in Lagos, and they are the ones that got me into working with women. And a particular girl I met under the bridge, she was involved with one of the young men. And in a few years, she had 3 young boys. She gave birth to 3 young boys. Their father was a homeless man that we popularly call an area boy. And it occurred to me that she didn't have the tools to look after these boys and keep them from the reality of their father. And so I thought if she knew better, she would do better. Absolutely. If she was helped, then she could help herself and her children. So I did get into working with women in a roundabout way. Prior to that, I was rather weary of women.
Wow. That's so true. And maybe the next question, you may know the Chess in Slum project.
The pardon?
Chess in Slum.
Chess in Slum.
In Slum. Tunde Onakoya.
Yes.
Is that Tunde?
Yes, I do.
Who works
I do.
with...
He's been to visit.
Yes,
he visited
absolutely.
us.
When you were sharing your story, it just reminded me of how we got also in working with homeless children. Women in Nigeria, the next question is around women's status, and particularly in Nigeria. They continue to face challenges in accessing economic opportunities. What, in your sense, what are the policies or initiatives that could accelerate women's financial independence in Nigeria?
I think all the policies are in place already.
Mm-hmm.
I believe all the laws are in place already.
Mm-hmm.
I believe everything is fine on paper. The theme for this year's International Women's Day is particularly instructive because it sets us in a place where we move beyond talking about it, beyond looking at what the law says, and moves us into actually putting it into action. I don't believe that the laws are inadequate, neither do I believe what people say is insufficient. What we probably need to do is step beyond the words into action. And for that young lady I spoke about, and many more, women, I believe we just need to see them. We just need to see them.
Mm-hmm.
For the CEO, as well as the homeless woman or the market woman, you just need to see her. Many times we overlook women.
Mm-hmm.
I feel sometimes that I'm not seen.
Mm-hmm.
So I'm sitting here and you might see the wife of the immediate past vice president. Mm-hmm. But do you see me?
Mm-hmm.
Do you know my hopes, my dreams, or my aspirations? Do you see me? Do you see my hurts? Do you see my needs or my wants? Do you see me? Do you know what makes me tick? Do you know what makes me laugh? Do you know what makes me cry? Do you see me?
Yeah.
So I think if we could be encouraged to look beyond the letters of the law and just see me and see every woman,
yeah,
I think we would do better.
That is a powerful statement for inclusion. Thank you very much for that very inspiring response. In many communities, cultural norms, as we all know, still limit women's opportunity. How do we strike a balance between respecting traditions and advancing towards gender equality?
That's a much tougher act, but it all starts with dialogue. It all starts with dialogue. The traditions of communities are very dear to their hearts, and it's not advisable to walk roughshod over people's traditions. But it is important to point out to those communities, just as I said, do you see the woman? Can you see the pain of female genital mutilation? Can you see the hurt of the injustice of being left out of inheritance? Can you see her? Can you identify that she exists, she's a person, and she has rights and needs and wants, and she's deserving of life, and deserving of a robust life, of a good life. She's deserving. So I think for the challenges that come with communities and traditions, dialogue is probably the way to go.
Yes, dialogue.
Because laws have been made about a lot of these things, but the laws haven't changed anything.
Absolutely.
It hasn't. There are lots of widowhood rights that are performed in certain communities, and it's performed by women, and it hurts women.
Absolutely.
And the laws are there, but it's time to talk about it.
Yeah, absolutely. I agree that dialogue will be one way to raise men's awareness gradually and maybe shift the mentalities and the norms over time.
I think the women's awareness as well, because both men and women are involved in limiting the quality of life of women.
Absolutely. If you could change one thing for women in Nigeria, what would it be?
Could I ask for 100? I think one would be far too small. Could I ask for at least 100?
Okay.
And maybe send in a document by the end of the day.
100 start by 1, so let's get started.
If I could change one thing, it would be, it may sound strange, but pardon me, it would be love.
Wow.
It would be love. Because if you had a baby that's a girl, and she's just a cute baby with chubby cheeks, and you love her, you won't want her to be hurt. And then one day she becomes 13. If you love her and you want her to be happy, it's unlikely you would send her off to an early marriage. I remember many years ago, I had an opportunity to visit with a 7-8-month-old baby in hospital with the former First Lady, and the baby had been raped. And I asked, what was she wearing? Because sometimes that's the question. What was the baby wearing? She had nappies on. And so if only we could legislate on love, perhaps go beyond legislating on it, if we could speak to one another and dialogue and encourage one another to love one another, then I think would be less likely to hurt one another, whether it's emotionally or financially or in any other way.
Wow, that's very powerful. Your Excellency, what message do you have for young girls who aspire to make a difference in their communities? Where should they start?
That I love. The message I have for them is that you are precious and you are special. You deserve to be here. You're here already. and you must make your mark. That's the message I have for them. I've spoken in many places and asked if you're having a baby in hospital. The baby could be a girl or a boy. You don't get charged differently. You're charged the same fee for having a boy or a girl. And when they go to school, you're not charged a different fee for a boy to go to school than for a girl. You're charged the same. When you sit on the bus or on the train or on a plane, you're not charged a different fee for being a boy or a girl. And why the injustice that the girls are not given equal opportunity. The message I have for the girls is you must know who you are. You must know who you are. I have often taken off my earrings and said, am I still me without my earrings? And yes, I am. Am I still me in one position or the other? They must know who they are, and they must know that they're here for a reason, and that reason must be accomplished. I would encourage them, in spite of the challenges they have, not to give up and to tell them that dreams come true. I've had the privilege of visiting schools to speak to young children for close to 20 years now. And it hurts me when I realize that some people don't dream anymore. They don't dream anymore. They've given up already, and they just literally live from day to day. And this is young children and the teachers sometimes, because we take a message to the children, but the teachers look transfixed. So I know the message is touching them as well. So I'd say to them, don't stop dreaming, because dreams do come true.
Absolutely.
Dreams do come true.
Well, this was a very, very inspiring conversation, Your Excellency. And we are really thrilled to hear how, this powerful message to young girls pursuing their dream, believing in themselves, but also a call to action for women to be seen, for girls, women and girls to be seen, and to prioritize dialogue, dialogue for women and also with women and men, so that we can actually overcome some cultural norms that are hurting women one way or the other. And also your call to spread love. I think that's my favorite, because with love you won't hurt anyone. People don't hurt each other. They will be kind, generous, and that will really advance gender equality. But let's hope for the best for that love. And also an important point in your conversation was enacting policies. We have all kinds of policies, but are they implemented? Are they tracked? Are they monitored? I think that is something maybe to reflect and see how we can walk away from designing policies to making sure that they implemented and we have tools to track them for accountability.
I believe that's really the message for the International Women's Day this year, the accelerated action. There's a young girl I met many years ago, and she was beaten by a belt for many years. And she said to me once that you have the people who hawk by the side of the road, and that once she saw a belt on sale and she ducked.
Wow.
Now, accelerated action should prompt us to ensure those that have done wrong, they face justice.
Absolutely.
And we also need to help the victims or the survivors, as we call them. But much more than that, we must prevent more victims being made. One of the popular phrases in our organization is opportunity must be absent. So you might have in your mind, I'm going to hurt her, I'm going to cheat her, I'm going to run off with her, I'm going to kidnap her. But if the opportunity is absent, then you never get a chance to carry it out. So accelerated action should prompt everyone, both male and female, to be the custodians of the girl child and the woman, especially because they have been quite badly treated up to this point. So accelerated action means we can't wait till tomorrow, and we can't rely only on the laws and on the letters. We must spring into action. And I'll give a few examples. And many of these come from experiences of people I've met and things I've encountered over the years. We run 2 facilities, a shelter for battered women and trafficked women. And accelerated action to me means you cannot have a child, male or female, unsupervised. You must have eyes on them.
Absolutely.
You must have eyes on them. If they're not your eyes, they can be the digital eyes, the cameras, or they can be other supervisors. Accelerated action says to me, you must catch the person who wants to harm the girl child before he does. Accelerated action to me means you cannot have your daughter examined by a male doctor without your presence, no matter what age the child is. Accelerated action to me means we must do checks and continual checks on people in authority over the girl child, the teachers and the community leaders, because the threats are much more potent when it comes from people like that. So accelerated action means as we sit here in this lovely air-conditioned room, a girl is screaming.
Absolutely.
Many girls are screaming, and many girls are crying. So we cannot rely only on the words. We must spring into action.
Thank you. I think we are at the end of this conversation. I think the one thing I would like to repeat after you is that one of the accelerated action should prompt us all to be the custodian of the girl child. It cannot be better said, and thank you so very much for coming and for this very inspiring conversation.
Thank you.
Thank you. A round of applause.
Thank you very much. We have Q&A, Your Excellency. So sorry. Yes, please.
Question? Yes. Kalilu?
Yeah. Thank you, Your Excellency, for those very insightful and touching comments and remarks. My question is actually, how do we, because hearing you, I see also a huge role for the men folk, if there's any terminology like that. How do we begin to elevate that message that actually, like you rightly put it, how do you take that responsibility of love? Because, I mean, even though we find instances where people molest or abuse their own child, but it's quite infinitesimal, and usually you find that borders on mental issues. But what are your thoughts about how do you, as a society, begin to elevate that role of male in actually protecting, the girl child and the woman? Because ultimately, I think there's a huge role for that, especially if you're looking at your remarks around love. If you also maybe is it about teaching men more responsible, raising more responsible men, kind of, so that catching them young, for instance, so that they also learn that there is a responsibility, to protect not just their own female relations, but also the other, girl child and women out there. Just your perspective on that. And I'd also maybe to say happy birthday to His Excellency in arrears.
Thank you so much. I'll pass on your message. Thank you. I'd answer that by saying a way you could do that is if you could be a voice for the woman in places where she isn't found. So sometimes there are male conversations that are around objectifying women, that the conversations are around what the women look like. The conversations are around what the men would like to do to the women. But the woman isn't there. Perhaps if our men could be a voice to say that she's a person, she's a human being. She's a human being. She's a human being. So that you see her, you see that she's human. She's not an article of clothing. She's not a drink. She's not tissues that can be used and discarded. She is actually a person. I had the opportunity of working for many years with not only area boys, also with prostitutes, because I red light districts in Lagos, I wandered around in there, and all I had was love for them, and love worked. And I found it was easier to get an area boy to step out of that life than to get a prostitute. I found that the process that we had of counseling and encouraging the women who had been in these very unnatural circumstances, the moment when they step out of that life and they attempt to step back into a normal life, it's almost like death. Yeah. It's unbelievable. Yeah. The process is unbelievable. So I think if people realize that what I'm doing or what I'm saying or my actions are creating someone that humanity is taken out of them, because I'm not a psychologist, but that's the only way I could understand it, that to live in certain spheres and under certain circumstances, they have to take humanity out of themselves. So they're literally almost like animals. So now you're saying, take humanity back. And they see themselves for almost like, can we move on? Yeah. Okay. But I'm just trying to say that it is unspeakable. The effect of some of these things is unspeakable and unimaginable. So if the men can be encouraged, just be a voice for women in places where the women cannot be found. Absolutely. I think that might be a start. Yeah. That might be a start.
Yusuf?
Your Excellency, some of the points you raised actually resonate with my previous work. When I was working in HIV and AIDS, what you just said about commercial sex workers, the way they were called then, really resonate. And I had real experience engaging those and trying to create alternative means of livelihood for them. It's really a struggle, but it's doable, Your Excellency. It's doable. Second is creating platform for women when they are not there. I think that's also doable. Why I picked the mic is to give you that assurance that it's doable and it's happening. Years back when I was working in my previous role as a state lead, we have this program we call Working with Men for Women. So we work at the community level to break 3 barriers. Barriers around access to immunization and maternal and child health, getting them to have access to life-saving blood, when they have hemorrhage, and having a savings, community savings, to help transport them on time when they need emergency care. So there are rudimentary work that is happening across the country, and the foundation is fully committed to really supporting those kind of initiatives at scale. So just giving you the assurance, Your Excellency, that these are happening, They are not quite large scale. And when you look at a country like Nigeria, when you work in 5, 6, 7 states, it's like a fraction. And then there are also uniqueness between and among states. But I think it's possible, and we have to, all of us, commit that this is something we all must take forward. With the inspiration of people like you, I think it's also my sister who also lead also the bulk of those work. I think we are energized and we are inspired, and I think we can fully commit to say we'll really take this forward. On your behalf, Your Excellency.
Thank you.
Thank you. I'd like to respond to that.
Go ahead.
The name of my organization is the Women's Helping Hands Initiative, and it was started in 2006. We have had the opportunity to help a lot of women, so I know it is possible. But even as a woman, and this is an example of a lady who was in Burkina Faso for, I think, for about 3 or 4 years as a sex worker. She started her business. She started off a restaurant. She was fine. But from time to time, she would still self-harm, roll on the floor, and be suicidal just because of the memories of what she had been through. So accelerated action is to prevent people from ever getting into that space whereby they have those memories. So thank you very much. I'm glad to know that we're many in the field working for women.
Absolutely. And that leads me to ask one question. What happened to that girl you mentioned when we first started the conversation? The one who has 3 babies with the homeless?
Well, I'm sure the babies will probably be teenagers now. They'll probably be teenagers now. Well, the best we could do for her was ensure she got medical care.
Okay.
So would pay for her bills. But she kept coming back out to see this homeless man. She kept coming back out to see him. And the next time we'd see her, she'd be pregnant again. And she didn't get much of an education before she started this relationship. So she really didn't have much she could do. So we helped as much as we could. And that's why I thought, rather than waiting till this happens, it's best to help the Women's Helping Hands. It's best to help them to know better so they can do better.
Do better. Absolutely. One more question. Grace?
Your Excellency, it's just so heartwarming seeing the way you speak, very, very, very low voice, full of love. Indeed, you did say that it's love you have to give. But as mothers who are working and raising girls in a society that is so focused on technology, you can be in the same house with your daughter and not know she's home because everybody's on their devices. In your experience, having walked all the way, leading the nation to running your own initiatives and foundation on your own, what advice would you give for working mothers so that we do not get to the point where our daughters have to experience this? What do we teach them? How do we handle them? And in your experience, how do we avoid pitfalls?
Right, that's a critical question because there's this thought that can a woman have it all? That can she have a successful home and can she also be successful at work? Can a woman have it all? And my answer to that is we need to ask her who she is and what she wants. And that's the start. So if this is what she wants, then she's got to figure out how to achieve her dream and how to achieve her goal. Just as I said, if you have to be at work, someone must have eyes on your child. Someone must have eyes on your child. Someone trusted must have eyes on your child. I'm just doing this because I know that social media can come and get me. And I'd like to say, don't believe everything you see on social media. My birthday is wrong on social media. Where I was born is wrong on social media. So I mean, I feel you can have it all, but you have to move with the seasons. There might be a season where you may have to give up a few things. You may have to give up a few things just so that you're available for both your home and you're available for your office as well. But it's possible to have both. But you must be sensitive to the seasons. Also, it's easier to correct in love than it is to correct in authority. So if I hug you and I give you cookies and milk, if I say, my dear, why don't you look at it this way? You'll listen to me faster than if, you can't stand me because I'm always holding a stake and I'm very contrary. So the more we develop relationships, the easier it is to find out what's going on in relationships. Also, we cannot afford to dig our heads in the sand. It's an era of technology. You need to know what is going on. You need to know what is going on. You need to have your ears to the ground. You have to understand the language of the child and the language of the times as well. There are limits and boundaries you can set up. There's some, if I say it, my children will come and get me and say, Mommy, why were you talking about us? The limits you can set at home. The limits you can set, it's your home and it's your limits. And the limits you can set, the boundaries you can set, just to safeguard your family. I believe you can have both, but it must be on your terms. It must be what you can work with. I don't know if that makes sense.
Yeah. Thank you. Thank you so very much. Last round of applause.
Thank you very much, Your Excellency. Thank you, Rodio. I'd like to please crave your indulgence, Your Excellency, to permit me to disrupt this gathering a little by going way out of the agenda. If your security details would please permit us to gather around you for an iconic photo. I can't miss this opportunity. So everybody please run forward. I think we should make heart signs, love. Heart signs, love. There's no progress without love. Yours is upside down. Thank you. Thank you very much. I'd like to now call on, I think we can all agree that it's been a deeply insightful day. I think my key learning, I don't know about you, but my key learning today is just, there's no progress without love. So it's all about love and then milk and cookies. And I'd like to stretch Her Excellency's comment around milk and cookies. It doesn't only apply to mothers correcting or speaking to their daughters. It applies to fathers. Fathers, please give milk and cookies. Managers, give milk and cookies. I'd like to call on Ekenem to close us out for the day. Thank you very much, everyone. It's been a pleasure.
So, you can have a seat. So, just in closing remarks, please, I just have your attention for 1 minute, please. For the closing remarks, we just want to, first of all, thank and honor every single woman that works in the foundation. Please clap for them. Thank you for all the sacrifices, the long hours, listening to us as men, working with us. Thank you for everything that you do. We truly honor and appreciate every single woman that works in the foundation. And I want to use the word dynamic woman that works in the foundation. Thank you so much. I want to say thank you to all our speakers from Engender Help. Please, let's clap for him, please. And our anchor from Health Tracker, our CEO herself. Thank you so much. for being here, and we love the fact that you all are using technology as a tool in this digital age to drive progress. So thank you for all the work you do. Dr. Moji, thank you for moderating that session. Thank you so much. We truly appreciate you. To all the organizers, from Fatima, Victoria, Starboy, Debbie, Dorcas, everyone that was in that team. Grace, if I'm missing anybody, please forgive me. Just meet me afterwards. Averti, so SA, thank you for all putting this together, and thank you for making this a success. And to Your Excellency, thank you so much, Coco, Rahima, all your team members. Thank you so much, sir. Thank you for everything you do, all the support and everything else. I know, and also to our media folks, thank you so much. Our security team, thank you. Every drivers, cleaners, every single one, we honor every single one of you. I think the only thing I would say is that, 3 women shaped my life, to where I am today. One was my grandmother. I'll go to the village. She was the wife of a king. But she would always take time for her grandchildren and talk to them and teach them about the values of life. So my first foray about values of life came from my grandmother. Then the second was my mother. My mother was a very strong woman. When you grow up with strong women, they teach you, they discipline you. I knew about HIV at the age of 7. She'll pull my ear and say, "Don't go and sleep around anybody." I was like, well, I'm just 7 years old. I'm just 7 years old. And also, I'll tell my mother this thing, but I saw her strength and I saw her weakness. The last 3 years of my mother's life, she had breast cancer. So I had to take care of her for 3 years. And I saw her strength break down physically, but I saw her strength move up spiritually. And she would tell me so many things about life, what to look for in a woman, how to treat a woman. And those things shape my values. So imagine when somebody knows they are going, what they really tell you and the messages, and how that guides you through your life. That was my mother. And then finally is my amazing wife. Yeah, she's on one of the floors here. So she and I thank her because when you meet the right person, you meet a mirror image of yourself, and that really shapes how you think and how you do things. So these are the women that have held me accountable, that have shaped my thinking. And so it's easy for me to walk into a foundation like this and work with women because they remind you of the values on how to treat a woman and how to respect a woman and how to, show honor to a woman. So once again, I want to say thank you to every dynamic woman at the foundation. Thank you for all you do, all your sacrifices. To my sister Rodio, thank you so much for the excellent moderation. She's our Senegalese sister, but our jollof rice is better. So thank you all for once again coming. I think lunch is served here and upstairs, so thank you so much. Thank you.